I first decided to go into medicine early in my undergraduate experience. Through my athletic career, I worked with trainers and orthopedic surgeons while playing basketball at Valparaiso University, which exposed me to medicine and kind of stuck with it after that. My name is Matt Dinnon. I'm a board-certified fellowship-trained podiatrist. I specialize in podiatric surgery. I chose podiatry because of the lifestyle. I have less call, I have more of a normal schedule. I get to work with my hands. I deal with generally healthy people that need something simple to make them feel better, and I enjoy what I do. I am board certified by the American Board of Foot and Ankle Surgery in both foot surgery as well as rear foot reconstructive and ankle surgery, which is a less common certification. I'm also fellowship trained, which a lot of podiatrists don't perform fellowships after their residency. I feel that it's important for a patient to truly understand the diagnosis and the treatment plan in order for it to be successful for them. I like to be very direct and clear about diagnosis and treatment plans and develop a good rapport with my patient so that we can make it lighthearted but yet very educational. I play golf. I enjoy boating. I formerly played a lot of basketball, but I've gotten to the point where my joints don't enjoy the basketball as much as I do anymore. I am a consulting physician with the University of Notre Dame, and I have participated in the Coaches versus Cancer program for the past 8 to 10 years. And I enjoy working with the athletes and the students at Notre Dame. Most important thing is if a patient is happy with their result. That's really what we're here for.